Tonight, infighting and insults. A bitter row engulfs the Conservative Party. MSPs back their Scottish leader's call for the Prime Minister to quit, while the UK Minister, who called him a lightweight, stands his ground.
If you take the King's shilling, you are beholden to the Crown.
What's your message to Jacob Rees-Mogg?
You should just go and have a long lie down, perhaps, preferably not in the House of Commons.
The Prime Minister is now isolating after a member of his family tested positive for COVID. Also making the headlines, isolation is cut to 5 days for people in England, but officials say it's too soon for Scotland to follow suit. I'm John Mackay in Glasgow.
And I'm Kellyanne Woodland in Edinburgh. This is the STV News at 6. Good evening. Bitter infighting has erupted within the Conservatives over the Downing Street party row. There is a particular split between the Scottish Tories and their colleagues in London. At Holyrood, MSPs are furious that senior Conservative Jacob Rees-Mogg dismissed the leader of the Scottish Party as a lightweight figure.
It all flared up after Douglas Ross publicly called for the Prime Minister to resign after Boris Johnson admitted being at a Downing Street garden party during lockdown. Our Westminster correspondent Catherine Sampson has the latest on a row that isn't going away.
On the pitch, part-time referee Douglas Ross is used to having his decisions questioned. Off it, he's now facing a backlash from his own side.
Douglas Ross has always been quite a lightweight figure.
A comment unlikely to ease tension over Partygate with Tories in Holyrood.
Jacob Rees-Mogg, as anyone, is entitled to their opinions. I don't have to agree with them.
The Prime Minister's position is untenable. I thought that was a very ill-advised remark from Jacob Rees-Mogg.
What's your message to Jacob Rees-Mogg?
You should just go and have a long lie down, perhaps, preferably not in the House of Commons.
But today, the leader of the Commons was standing by his remarks.
I think that if you are the leader of the Scottish Conservative Party, it is your duty to support the leader of the party nationally. That the backbenchers are entitled to express their views, and backbench MSPs likewise, and former Scottish leaders, one of whom is a very significant political figure, are entitled to express their views. But if you take the King's shilling, you are beholden to the Crown.
In Douglas Ross's Elgin constituency, many are not fine and dandy with the party row, or with someone looking down on their local MP.
Is he a lightweight?
No, I think he's right in Boris should be punished and resign, and the rest of the people that went to the party should be as well.
By saying that about Douglas Ross, he's handed it to SNP something to shout about, saying that the government in London are against Scotland again.
It was seized upon by Nicola Sturgeon at First Minister's questions.
Not a big figure, lightweight. These might be personal insults directed at the leader of the Scottish Conservatives, but actually they say something much deeper about the Westminster establishment's utter contempt for Scotland. If they can't even show basic respect for their own colleagues, what chance do the rest of us have?
At Westminster, the only Scottish Tory MP willing to publicly back Boris Johnson is the Scottish Secretary.
I'm 110% behind the Prime Minister. I think he's done a fantastic job throughout the pandemic, not just with vaccines, with the booster, resisting going into restrictions for the economy.
But all this has thrown division between Scotland and London into sharp focus.
I don't think there is a rift at all. There's clearly a difference of opinion. Some people want to wait to see the result of the civil service inquiry, but Douglas set out those conditions. We supported him in having done that, and if people take different views, then that's fine.
As the fallout continues, the row over Downing Street parties has moved beyond just the future of Boris Johnson's job.
Well, live now to Catherine in Westminster. And Catherine, we haven't actually seen Boris Johnson today.
No, the Prime Minister, we're told, has a family member who has tested positive for COVID. He is holed up in Downing Street, where we're told he will be isolating for 5 days. The question tonight, of course, how isolated is he from his own party? Well, some of his ministers have been rallying behind Boris Johnson today, but you look at that situation in Scotland and you think, well, you can't help but wonder if some long-term damage has been done here, especially for a Prime Minister who has styled himself as Minister Minister for the Union. Now, many MPs, including the other Scottish Tory MPs, would tell you they are waiting for the Sue Gray investigation into alleged Downing Street parties to report back before they make any of their views public. But, you know, it is interesting to state again that the only Scottish MP who has been prepared to publicly back Boris Johnson so far is his Scottish Secretary, who of course is in his cabinet and on his payroll.
Catherine in Westminster, thank you. A leading advisor to the Scottish Government has said it's too soon to recommend cutting the isolation period for people who test positive for coronavirus here, despite England announcing a reduction to 5 full days.
Professor Jason Leach told a Holyrood committee that as Scotland only shortened the time from 10 days to 7 last week, it's important to be sure the risk of spreading COVID isn't increased. Here's our senior reporter, Gordon Cree.
With the prevalence of COVID high across the country, the figures on individual neighbourhoods may matter to us less than they once did. For health officials, though, they're vital for tracking the progress of the virus. Over the past week, the streets around Whitecrook in West Dunbartonshire had the highest infection rate in Scotland.
Numbers are high, I do know that, I appreciate that, but I am going out and doing a bit more.
People that are not taking precautions, to me, are not very sensible.
It's one of those things to take the middle ground between being cautious. I don't want to be fearful.
From today, the number of new COVID cases includes anyone who's submitted a positive lateral flow test. The figure recorded today across Scotland was 8,203 new infections. That compares with 11,360 on the 6th of January, which was the last day anyone without symptoms testing positive on one of these had to have it confirmed with a PCR test, which at the time was the sole way infections were counted. For anyone contracting the virus in England, the time they'll have to spend in isolation is being cut.
My instinct right now is we've only just moved from 10 to 7. We need to let that work through in the real world. We need to see what happens with 10 to 7 before we would give advice about 7 to what would effectively be 6.
The Scottish Government said tonight that differences in the way the days are counted means it believes the change in England makes the isolation time the same as it is here. As the health service continues to deal with the impact of the virus in Lanarkshire, that pressure's become so acute that GPs have been asked to focus only on the most urgent care.
What am I supposed to tell constituents in Lanarkshire who are reaching for the Samaritan Scotland phone number because they can't get through to GP surgeries? They feel they're not allowed to go to A&E. The letter from NHS Lanarkshire yesterday didn't even mention mental health.
The First Minister said the decision by NHS Lanarkshire had been taken to ensure they can maintain access to essential services at a time of unprecedented demand on staff absences. Officials believe we are now at or close to the peak in COVID cases. Those on the front line can only hope the end is in sight. Gordon Cree, STV News.
On Scotland Tonight, we'll have Professor Jason Leach answering your questions. Have we reached that peak? And what are the risks of cutting isolation to 5 days? That's Scotland Tonight at 7:30.
Now, unvaccinated expectant mums are far more likely to suffer from birth-related complications later in their pregnancy than those who are fully vaccinated. A University of Edinburgh study found 98% of pregnant women admitted to ICU where COVID-19 were not jagged.
Those behind the report say too much mixed messaging early on in the vaccine rollout has left many mums-to-be with reservations. Our political reporter Laura Alderman has the story.
Yeah, you're talking.
Throughout her pregnancy with baby Poppy, mum Gemma had many questions and choices to make. One that she did linger over was whether or not to have the COVID vaccine.
My midwife told me when I first got a check in January that it wasn't advised to get it. I went back about 4 weeks later and she said actually the advice has changed, it's safe, they've done some studies and it's now recommended to get it. At the very beginning I actually was leaning more towards not getting it, but I'm so glad I got it now because I mean everything was fine with my pregnancy and her, and then when she came out and then she's probably got some sort of antibodies against it I'd imagine now, so yeah.
It's a delicate issue with mixed opinions.
I've had my 2 vaccines just now. I'm waiting until I've had the baby to have my booster, only because I'm not really 100% on getting it. It's just the not knowing of maybe how it would react or how I would react to it. Because the last 2 that I got, I was quite poorly with it.
My first vaccine, I was probably about 24 weeks pregnant when I got it, and I guess my decision is a little bit different because I'm a healthcare worker. So my risk benefit was a bit more skewed towards getting the vaccine because I was working in COVID environments in the hospital.
One of the first national studies on pregnancy and COVID-19 from the University of Edinburgh found women who contract the virus towards the end of their pregnancy are more vulnerable to birth-related complications. 98% of pregnant women admitted to ICU with COVID-19 were unvaccinated, and only 32% of pregnant women who gave birth in October last year were fully vaccinated.
Women who are pregnant are more likely to have severe complications from COVID-19, so more likely to need hospital admission, more likely than somebody who's not pregnant to need intensive care unit admission. And very sadly, what we're seeing again in our study is that towards the end of pregnancy there are severe complications for the baby. But we now have consistent and clear evidence that vaccination is the most effective way to protect pregnant women and their babies and can be given at any time in pregnancy.
With the Omicron variant still circulating widely, efforts are ramping up to get more expectant mums vaccinated and help protect 2 lives instead of 1.
Well, Laura joins us now in the studio. So, Laura, what have you been hearing from expectant mums?
Well, I've been speaking to mums-to-be and new mums all day today, and one of them that you heard in my report there was a doctor. She was telling me that at the minute their ICU department is filling up with unvaccinated pregnant women, so clearly a big concern.
I suppose when pregnant, some of us are concerned about taking any medication at best.
Yeah, you're absolutely right. And I think part of the issue is that there's maybe just sometimes not enough research on pregnant women, and some women don't want to take part in studies if they're carrying a child. So you can understand how anxious a thought of a new vaccine might make some women. But I think there is still quite a lot of misinformation out there, and ultimately all mums want to do is what's best for their baby. But the authors of this report today are saying, look, here it is, here's the proof that vaccines are the best tool to protect you and your baby. And one important final point to make is that this study looked at data up to October last year, so before Omicron hit. The authors are very worried that the most recent up-to-date stats could be far, far higher.
All right, Laura, a very sensitive issue. Thanks very much for joining us.
The new chair of the Drug Deaths Task Force is David Strang, a former Chief Constable of Lothian and Borders Police. The appointment comes as another small step is taken towards establishing the country's first safer drug consumption room. The Scottish Government says it's working closely with health officials, police and prosecutors. Here's our Chief Reporter, Sharon Frew.
A historic moment here inside this building in East Harlem.
New York in November, when the first of 2 overdose prevention centres opened its doors. Here, people can inject drugs without the threat of arrest under the watch of trained staff. City leaders found a way to work around federal laws to authorise the first publicly recognised safe consumption rooms.
This is a joyful moment, but it's such a sad moment also because we lost so many people waiting for this to happen.
With the UK government opposed to any changes in drug laws, the Scottish Government says it's moving forward with talks on how a facility could operate within existing legislation.
A new service proposal in Glasgow has been provided, and we are continuing to work closely with the Glasgow Health and Social Care Partnership, the police and the Crown Office to ensure we have a sustainable approach which is clinically and legally safe for staff and those using it.
COVID will also present challenges in the implementation of any new service. 4 years after submitting their first proposal, health officials in Glasgow hope the new case will be made to the Lord Advocate within months.
We are very much wanting to deliver this as soon as possible, and I'll just say now that I'd be disappointed if it's not delivered within 2022.
David Strang, a former Chief Constable of Lothian and Borders Police, will now take over at the helm of the Drugs Deaths Task Force. Professor Katrina Matheson resigned because she said she was not prepared to do a rush job when the group was asked to submit its final recommendations 6 months early. Campaigners want to see urgent change.
There was a couple of wee nuggets of hope there, you know, that they are looking for progress and that they are willing to work with new partners. So I hope that means that they're going to take the voice of lived experience a lot more serious.
Just one of the many demands facing the new chair when the task force meets for the first time next week under his leadership. Sharon Frew, STV News.
Now, 100 years ago this month, the first type 1 diabetes patient was treated with an insulin injection. It was a scientific breakthrough that would revolutionise treatment of the condition, which had previously been a death sentence.
Now, a football-mad Ayrshire teenager has set up a charity aimed at showing that anyone with type 1 can live life to the full. He's being backed by sports stars from across the country. Here's Ollie Dickinson.
Like so many teenagers up and down the country, Lachlan Murdoch loves playing football for his local club.
I love football. Well, I support Kelly. I play with Bonton. 2 times a week with Bonton.
And who's your favourite player? Who do you model yourself on?
Probably Kevin De Bruyne.
But unlike his teammates, Lachlan lives with type 1 diabetes, an incurable genetic disorder that develops early in life and has to be carefully managed to avoid long-term damage. Dundee's Paul McMullen is one of Lachlan's heroes, and not just for his footballing skill. The midfielder also lives with type 1 diabetes.
Well, having kind of gone through, he's relatively close to kind of ages that I was kind of when I got it. I think I got it when I was about 13. And when you get it as a kid, it's tough because not a lot of people know a lot of stuff about it. I had friends come up to me and ask if they could catch it off me. And that's just the kind of, that was what it was. You didn't understand and it was pretty tough. There was not really any other than maybe a physio at the club that you could ask for help because nobody else really understood it that well.
But understanding and treatment of diabetes has come a long way in the 100 years since the first successful insulin injection. Nowadays, some can manage the condition with a pump and a phone app, removing the need for finger pricks and injections.
9.6 millimoles per litre.
It's really only from the late 70s when changes in treatment started to really happen, and even more so in the past 20 or 30 years when we look at the technologies that are used to treat diabetes, which have undoubtedly improved the quality of life.
Now aged 13, Lachlan has launched a charity to help people understand the condition.
A lot of people that want to join these kind of sporting events don't want to go because there's stigma and they just think they'll get bullied or something like the things. So we're trying to take that away from folk, and it doesn't matter if you've got type 1, you can still do anything you want.
He's determined to live life to the full and wants others with type 1 to know they can too. Ollie Dickinson, STV News.
Scotland's first dedicated gym for disabled people has opened in Midlothian. The owner set up the facility after noticing a lack of specialist equipment at mainstream gyms and sports clubs, while Indigo's Stafford has been checking it out.
Mary was born with spina bifida and hearing loss. She loves blowing off steam with a boxing session, but at times she has found accessing a mainstream gym to be a challenge.
I think that disabled people were put off coming into a gym full of able-bodied folk, seeing them using equipment they couldn't use. But then this gym has got everything disabled people can use.
Done by 3 seconds?
Yeah.
Well done.
Personal trainer Dale worked with disabled people for over 15 years before opening up the gym and witnessed firsthand the barriers to participation that they often face.
I was coaching tennis at a mainstream school and there was a little girl in a wheelchair. She never took part for the first couple of sessions, so we started to get involved and we found that she could hit a ball as well as the rest of her classmates. I think from then was when I kind of realised that it wasn't her disability that prevented her from taking part, it was a lack of knowledge and support.
This knowledge and experience is invaluable to client Jean, who has a rare condition which can cause his brittle bones to suddenly break.
I think entering a mainstream gym has been quite challenging. Although the staff are usually really welcoming and supportive, they don't have that expertise. It kind of wasn't the same experience that non-disabled people were having in the gym, so I was made to feel quite different as a result of that.
Around 1 million people in Scotland have a disability, but only around 1 in 4 sports clubs feel they have the appropriate equipment and facilities for disabled people to be able to equally participate.
You know, people with disabilities and long-term health conditions are still much less active than their non-disabled peers. So, you know, 54% are physically active compared to 88% of non-disabled people. But we also know that there's a latent demand out there. 4 out of 5 disabled people want to be more physically active.
While this gym is the only one of its kind in Scotland for now, it offers hope that more dedicated facilities could open up in the future. Indigo Stafford, STV News, Straighton.
OK, let's see what the weather has in store. Here's Sean.
Today's outlook is becoming more and more unsettled. TUI Blue Hotels sponsor STV Weather.
Well, we've still got that very mild Mediterranean airflow at the moment, our air coming in from the far south, and that's been boosting our temperatures up to about 12 degrees in the north of Scotland today. We've had the best of our breaks in the cloud cover today across northeastern parts of Fife, Cooper, St Andrews doing fairly well, and our temperatures doing pretty well here too. We go into cooler air this weekend. Can't believe I'm using the word cooler in January, but cooler air, temperatures back closer to where they should be for the time of year before next week we go back into those crazy numbers once again as that milder air starts to move back in. Now, temperatures today have averaged about 6-7 degrees for many of us, and tonight again those temperatures staying pretty much static day and night at the moment. As said yesterday, the weather rather benign, not really changing too much. Now, tomorrow, again, we should see the best of any brighter spells. It does look as if Fife and eastern borders probably doing fairly well, and with light winds, not feeling too bad. No sunny spells, with temperatures up to about, the same as where they've been today, tonight, 7-8 degrees Celsius. Now, expect into the weekend, we'll always hang on to a lot of cloud, especially in the west of the country. We'll see the best of any brighter weather on Saturday. Temperatures about 8 degrees. On Sunday, expect we'll see better spells of sunshine. That's because we'll have a fairly brisk westerly wind, so the cloud breaking up for us. In the west, for them, it stays largely cloudy with outbreaks of rain.
TUI Blue Hotels sponsor STV Weather.
And finally, we've been hearing Andy Murray's been doing well in Australia. Well, one couple who went to watch to play in Sydney, the last thing they expected was to be invited back as VIP guests.
Oh yes, Stephen Glennie and Jodie Maggs, who live in Australia but are from Dundee, have found themselves the centre of worldwide attention after Andy's mum Judy offered free tickets to say thanks for their enthusiastic support. And they're hoping they'll be cheering him on until the very end. Vanessa Kennedy has more.
They didn't expect to be here today, but thanks to the power of social media, these superfans from Dundee are now some of Andy Murray's biggest supporters.
Obviously, Scottish fans, we were literally in the crowd, chanting, cheering, like egging him on. He was clocking when he was like giving me the eye contact because we were literally above him and we had the Scottish flag and he was loving life. He knew that we were there.
And it was that very vocal support that got them noticed by Judy Murray. And after this tweet went viral, they woke up to a big surprise.
We woke up the next morning and Judy Murray had WhatsApp Stephen. She'd WhatsApp Stephen and was saying we need to get in touch with you. We want to invite you to the quarter-finals.
And it sounds like she may get a few more requests from now on.
If anyone wants free tickets to my matches, turn up with the Scottish flag and maybe, my mum might offer a few tickets.
And after such a social media storm, the pair are definitely in demand.
It's actually been really crazy. We have came out from the game today and our phone has just literally blew up. Instagram, Facebook, even mum's wanting an interview. Everyone's just went wild.
And the ride's not over yet. Judy's also given them tickets to tomorrow's semi-final. So after being Andy's lucky charm so far, they say they'll now follow him to the very end.
Let's go! Let's go, Andy! Let's go!
Vanessa Kennedy, STV News.
Oh, I'm pretty sure we'll be seeing them again, cheering Andy on.
Don't forget, Professor Jason Leach coming up in an hour on Scotland Tonight. From all of us, thanks for watching. Have a good night.
Bye-bye.